He works right here in the city of Douala. It is a pleasure having you on the program today, Doctor.
Thank you, Immaculate. You're welcome.
Today we are going to be focusing on a very delicate type of pregnancy known as ectopic pregnancy. When I mean delicate is because we know some of the challenges that comes with having such a pregnancy. So for our listeners who are watching and those who are listening on radio, what exactly is an ectopic? Hello, good afternoon to you all. Thank you for tuning in to today's edition of the program You and Your Health and on Equinoxe Radio. It's another Thursday and we are out to talk about health-related matters. Today on the program we'll be looking at pregnant women as we have always been doing. Why? Because these women go through a lot of challenges during this period and it's a very delicate period for some of these women. That's why we have dedicated this week for these women who are pregnant. We are trying to make life extremely easy for them during this period. But this time around, we'll not be looking at a normal pregnancy. We'll be looking at what is called an ectopic pregnancy. By the way, any woman can have an ectopic pregnancy. And in fact, at least 1/3 of women who experience an ectopic pregnancy have no risk factors. However, there are some things that may increase a woman's risk of having an ectopic pregnancy. What are some of these things? Answers in the course of this program, but that will be after this short break. Thank you for staying with us on Equinoxe Radio Multimedia. With me in the studio, we have an obstetrician and a gynecologist. He's called Dr. Tingang Kamgang. He works right here in the city of Douala. It is a pleasure having you on the program today, Doctor.
Thank you, Immaculate. You're welcome.
Today we are going to be focusing on a very delicate type of pregnancy known as ectopic pregnancy. When I mean delicate is because we know some of the challenges that comes with having such a pregnancy. So for our listeners who are watching and those who are listening on radio, what exactly is an ectopic pregnancy?
Okay, thank you, Immaculate. I want to first of all greet all your televiewers and auditors over the world. What is ectopic pregnancy? Ectopic pregnancy is a pregnancy that occurs outside the lining, the normal uterine lining of the womb. So the uterus will occur outside the cavity of the uterus.
Okay, outside, not in the womb.
Not in the womb.
So now, how can a woman know she's having such a situation?
The woman, how can she know? Most of the time, she will not know that she has something that is happening. Is the symptoms that may manifest. But no, most of the time, ectopic pregnancy are asymptomatic. That is, they don't have symptoms until they become big and huge. And where it's located, maybe the membrane can break, like in tubes or in the ovary or elsewhere. It can get break and it can start being stretched, and she will start feeling some pains. And other symptoms that we will talk about.
You talked about the symptoms. What are they?
The symptoms, yeah. I said they can be asymptomatic in some cases when it's not ruptured, when it's located, and when it's ruptured, the woman can experience some pains under the abdomen, below the abdomen. She may experience bleeding, bleeding when she has missed period and she starts having bleeding. She may also have sudden lower abdominal pain, especially when there's rupture of the ectopic pregnancy. Most of the time it occurs at the level of the tube of the woman. When it's big, when it becomes grow, the tube can get burst, and she will have pain. She will start bleeding inside the womb. She may have symptoms like fainting. She may experience, it may be sudden, or if it's chronic leaking of the blood inside the abdomen, she may have she'll have pains. She'll have gradual pains, and which is acute. The pain will be acute, and she may even faint. She may even collapse in the market, and they take her to the hospital.
Is it only the fallopian tubes that is affected during ectopic?
No, it cannot only. If you permit, I can show you on this. So This is the normal genitalia. This is the womb, and this is the vagina. This is the womb. This is the fallopian tube. The fertilization occurs here, and the embryo starts migrating. First, second, and the fifth or sixth day implant in the womb. This is the normal implantation of the pregnancy. So the ectopic pregnancy can either implant here in the tube. We call it ectopic fallopian implantation. It can implant here in the ovary.
Yeah.
It can even implant lower at the cervix. It can go beyond and implant inside the abdomen. So there are various. It can also occur here at the cornwall, and when it occurs here at the cornwall, it may take more time for it to express. Yes. When it's in the you see the tube is very tiny.
Yeah.
If the pregnancy get implant here, when it start growing, become big, you widen and you stretch and you get burst. You start feeling pains. If you rupture, she'll bleed heavily in the abdomen, she'll collapse, and she may faint, she can enter a coma, and in some situations, if you don't act faster, she can lose her life.
Oh la la. So now what can cause that?
What are the causes of the ectopic pregnancy? Most of the time, it's due to secondary to infection, sexually transmitted infection, like chlamydia trachomatis, like mycoplasma, like gonorrhea. When it's not treated early enough, and even when it's treated, you may still run a risk of having ectopic pregnancy. When you have such infection, you end up with some lesion inside the lumen of the tube, and the pregnancy which occurs here, the fertilization, the embryo will not have enough space to migrate to reach the womb. It may get stuck on the way. In some women, this fallopian tube may be very longer, and the time to migrate to go to the womb, or they will stop somewhere and grow there and be ectopic. In some situations too, you can have what we call transmigration.
Yeah.
Transmigration, that is the ovulation occurs here at the left side, and it's the right fallopian tube that picks the egg. So the distance to
get to that level
is too long, and the embryo will end up implanting somewhere in the tube, and it is ectopic pregnancy. In some situations, the embryo, there may be some contraction, and the womb, and the propose the embryo right at the cervix, and you got implant elsewhere. Why in the abdomen too, it can get implant in the abdomen in some situations where you have previous surgeries with a lot of adhesion in the abdomen, and the embryo can get implant in the abdomen too.
Are there different types of ectopic pregnancy?
Yeah, these are the different location of the
where it's located
pregnancy.
now.
Yeah, most of the time it's located in the fallopian tube, as I said. If it's at this extremity at time, and if you diagnose very early, it's possible to save the tube. You can just do a minor surgery and remove the pregnancy, and it can also locate at the cornwall here. It takes time because it's more thick. You get rupture like around 3 months, but when it's here, usually around 7 weeks or 9 weeks, you get ruptured. It can also develop at the level of cervix or in the abdomen. And the abdomen may take longer time to diagnose, and we have most difficult problem to diagnose abdominal pregnancy.
So let's say a woman is still 1 month old pregnant. Is there a possibility of detecting that this woman is having an ectopic pregnancy at that stage?
Of course, it's possible to detect that she's. That's why nowadays it's important for women to come to the hospital early. It's true that it's not for all the public, but it's advisable to come to the hospital early, so that because not when the pregnancy test is positive, it doesn't tell you if the pregnancy is inside the womb or if it is outside the womb. So the early echography and early ultrasonography will help us to locate the pregnancy. Usually around 6 to 7 weeks, we'll know if it is inside the womb or it is outside. When it's ectopic, the womb will be empty. You may see at the ultrasonography a sac beside the womb. Or if it's empty, your pregnancy test which is positive, you can see the sac, or you don't see. You have positive pregnancy test, and the womb is empty,
Yeah.
you can start suspecting the ectopic pregnancy. Then you have to ask the woman maybe to come after 2 weeks if she's not feeling pains. If she's feeling pain, you have to shorten the period. Maybe after 1 week, she has to come to repeat an ecography. If it's still empty, you know that okay, the pregnancy is somewhere else. You can also make a dosage of the pregnancy. I mean the plasmatic beta stage, as you call it in French. You have to make a dosage to know if his pregnancy is growing or not.
Talking about who is at risk of suffering from an ectopic pregnancy, does age matter in this?
The age, is usually, like all pregnancies, the woman of a reproductive age between 15 to 45 years. Yeah, they are at risk. It's true that most of the time is the past history of the patient. If he's a patient that have had regular sexually infected STD disease, yes, she run more risk to have ectopic pregnancy than those who have a safe life.
And other factors? No other factors apart from STDs?
Most of the time that is
Can smoking, drinking alcohol cause that, or it has nothing to do with that?
Smoking, drinking alcohol, there have been substitution, but it's not really directly linked to the to ectopic pregnancy. Most of the time, you have congenital malformation, like I've said. When you have a woman has a tube that is very longer, it takes time to reach the womb for the embryo. When it's fertilized, it can get stuck on the way. But most of the time, it's secondary to the damage of the tubes inside the lumen of the tube. There are some adhesion, because at the end, let me say it again. One episode of infection of chlamydia or mycoplasma will lead to 15% of chance of obstruction of the tube or lesion of the tube. Even when it's well treated, she still have that 15%. 2 episodes, 30%. 3 episodes, 45%. So women should avoid as much as possible to have repeated infection, and also when it occurs, you have to treat early. So when there's damage, there's some adhesion in the lumen of the tube. It will render the embryo will not move normally to reach the normal lining of the uterus, and it gets stuck somewhere, and you have the ectopic pregnancy. Yeah.
Is there a possibility for a pregnant woman with this condition to deliver a baby normally? Like get to the level of delivery still being with an ectopic pregnancy?
It's difficult because the anatomic constitution of the tube will not permit the embryo to grow up to the level of to maturity to deliver. Yes, we have had cases of delivery, term delivery or advanced stage of delivery when the pregnancy is inside the abdomen. There's a space to grow. At times the placenta will go attached on the liver or on the bowels. The baby will grow in a sac in the abdomen, and there is more risk of malformation in such a situation because normally the womb is solid because it's made up of muscle, which keep the baby well in the sac. Meanwhile, in the abdomen is floating, and there's risk of a malformation in such situation. But when ectopic is inside the abdomen, there's possibility that the baby may grow up to a stage of delivery. But in that situation, it will be cesarean section. You have to operate the woman, remove the baby, attach the placenta, the cord, and look where the placenta is located. If the placenta is located at the fundus on the womb, it's possible to detach. But if it's located on the bowels, if it's located on the liver, it's very risky to try to remove it. Most of the time, you have to just tie the cord, umbilical cord, as shortest as possible, and leave the placenta there. You give some medication for it to dissolve the placenta, and then you can save the life of the woman. Otherwise, you try to remove that placenta, which is located on the bowels, you may end up losing the woman on the table.
So now that means treatment should be done as fast as possible.
Yes, the treatment should be early as possible. That's why it's important to make the diagnosis as early as possible. The woman should come early to the hospital. When she expresses she has missed period, pregnancy test positive, you have to do a ultrasonography if the womb is empty or you have see a sac outside the uterine lining, or you don't see it, and you experience that the hormonal level of HCG is growing, you know that it's ectopic, then you have three possibilities of treatment. Either you abstain, or you do medical treatment, or you do surgical treatment. Abstention of the treatment is when you make sure the pregnancy is not evolving and that the dosage of beta-HCG are going down, and that situation, and the woman is asymptomatic, she doesn't have any symptoms, then you can observe 2 days, after 5 days, 1 week, up to 2 to 3 months until you make sure that the pregnancy test become negative. Second option, you have medical treatment. The medical treatment, you can give an injection that will go and dissolve the pregnancy, ectopic pregnancy, where it is located, either in the ovary, either in the tube. You get dissolved. You have to follow up. At least it usually takes like 1 month or 2 or 3 months, and the woman should be put on the pill for at least 3 months. You not be expected to take in before 3 months.
Okay.
The last option is the surgical treatment. A surgical treatment will occur when you have ectopic pregnancy, which is symptomatic. It can be painful or not painful, or when you have failure of medical treatment, then you have to go in for surgery. There are different modalities of surgical treatment. You have, if you come early enough, we can do minimal surgery, which we call cystoscopy. That is operation without making a large opening. You just make a small incision under the umbilicus and 2 other incisions, and you go and either the surgery either just make a small incision on the tube and remove the pregnancy. If it is the tube is damaged, they will remove all the tubes. And make sure he describes the rest of the tube and the ovary, because it's important for the follow-up. So we can make an incision, we can remove the tube, we call this appendectomy. Or if it's a condom, you have to make an incision and remove the pregnancy. If it's in the abdomen, therefore, it can also, you can see what it can do, either remove the embryo if it's already dead and leave the placenta there. So these are different options of the surgical treatment of management of ectopic pregnancy.
You talked about pills. Don't you think the pills can have an effect on that baby, on the unborn baby, sorry?
The pills is not when she's pregnant. The pill is after the procedure. It's not a procedure. When a woman has had ectopic pregnancy, you have to wait like 3 months before she experiences another pregnancy. Then you can give a oral contraceptive pill to control that she should not take in before. Because if she take in too early, she may run another risk of. It's true that she's already had a woman who has had ectopic pregnancy has 10 to 25% of chance of recurrence.
Of recovery.
Yes, of recurrence. They can recur.
Okay, recurrence.
Because most of the time the ectopic pregnancy occur on the breast tube. That because when it's make the tube damage, so the ectopic pregnancy usually occur on the next tube
that is in a good shape.
In a good shape, good situation. Okay. So that when you leave the other tube, the risk is important. When a woman has had ectopic pregnancy, when she has missed her period, she should come very early for us to rule out another ectopic pregnancy. And they might be lucky, like the one I saw this morning, the woman of 24 years. She had ectopic pregnancy at the age of 22, and she was lucky to have they have removed the one tube. The other thing was quite nice, and she's going to deliver very soon. Wow. She's at term, and she's conceived one tube, but she's lucky. But that's why it's important to come to the hospital early. Then you can save the tube, the remaining tube.
Talking about ectopic pregnancy, is it painful?
It becomes painful when it's either ruptured or when it increases in size. Normally, at the beginning, the ectopic pregnancy is not painful. When it increases in size, you stretch and the woman will start having pain. When it gets ruptured, she'll have sudden pain. She may collapse in the market, and they'll carry her to the hospital. And
So that means if it's not diagnosed early enough, we can talk about death.
Yes, that's why, it's important to come to the hospital early. When you have missed the period, 1-2 weeks, you should come to the doctor, and then you can save the tube.
So now forgetting about ectopic pregnancy, is there a type of food women in such condition need to eat at that moment? Is there a specific thing they need to do during that period?
No, there's no specific thing. The food or there's not or drink will not change anything. It's ectopic. It's a location. It's poor. It's badly located. There's nothing you can do. Somebody asks, okay, can you take the pregnancy outside there and come and put it in the room?
Exactly.
No, it's not possible. It's not possible.
Like with a surgical situation, there's no way of doing that.
No, it's difficult to do that. It's difficult to do that because there are links physiologically, anatomy, to take that embryo to come and put implant in the womb. That it's not possible for now to do that.
So that means there's no way of bringing it to the womb. It means the woman loses a child automatically.
Most of the time, yes. There's no way. When it's ectopic, it's ectopic. You have to act early enough to try to either save the tube. When you diagnose early and you have good criteria, is the treatment is well done, the woman can rescue the tube in 85% of the case. The medical treatment, yes, it's only single dose. That it may be repeated after 1 or 2 weeks, depending on the evolution. A single treatment injection, you make the pregnancy dissolve where it is.
You said for a woman who once had an ectopic pregnancy, there's still more 35% chances that she can still have another ectopic pregnancy. That means in order to avoid such, what should this woman do at that moment?
It's when we advise them, when they leave hospital after the surgery or after the medical treatment, whenever they miss the period, they should come early enough. That is 1 week. They should not wait. 1 week, they have to come. We do ecography to rule out. At 5 weeks of pregnancy, you have to know if the pregnancy is in the womb or beside the womb.
Okay.
Then if it's inside the womb, then you know after 2 weeks you have to. That time, at 5 weeks, you don't see the embryo. But 2 weeks later or 3 weeks, you will see the embryo developing. When they come early, we can try to save the tube, either to do medical treatment early if it's ectopic again, and be sure that the pregnancy is inside the womb normally.
How then can women prevent an ectopic pregnancy?
How to prevent? When it's constitutional, but as we have explained, most of the time the tubes are damaged secondary to sexually transmitted infection. So it's the same prevention, like prevent sexually transmitted infection like chlamydia, mycoplasma. That is avoid early intercourse, avoid multiplicity of partner, sexual partner. When you have treatment, when you have infection, you should be treated early enough and good, and take the treatment adequately. The duration that the doctor, that's it. You should respect that. And even when you have pregnancy, you are pregnant, you come early to the hospital, and we may be able to roll it out early.
Thank you so much, Dr. Tingan Kamgang, on that clarification on ectopic pregnancy. And that will end today's edition of the program You're on Your Health and on Equinoxe Radio Multimedia. For presentation, I am Immaculate Fogwe, and I received technical assistance from Raphael Dipanda. Have a lovely day in the company of more programs on Equinoxe Radio and, of course, television. So long.